Hi dear surgeons and NEET Super Specialty 2020 aspirants. So this is a small video as per the request by the students how to go and prepare for NEET Super Specialty 2022, that is an exit exam for surgeons as well as physicians. So the 2021 in NEET Super Specialty and NEET PG all have given an idea. The exam is moving more towards a conceptual based questions and image based questions. Okay, so for super specialty aspirants, what is the plan for the concept to guide and coach them? It's very simple. For example, for surgeons, we basically go with Bailey and Sebastian. Both are Bible. But in addition to the Bailey and Sebastian, for example, urology, stone, trauma and tumors are the high yield areas. So all these three areas, the questions will be asked. Questions also will be added from Campbell because they used to ask content beyond Bailey and Love also. So Sebastian, and in addition to the Sebastian and Bailey, the tumor, stones and the trauma, the content will be added from Campbell also. Similarly, the rest of the high yield, rest of the system also will be handled in a similar way. Other faculties also will be discussing regarding this in the subsequent videos. Thank you.
I'm Dr. Rajalakshmi. I'm a consultant neurosurgeon and also a mentor at Koncpt for neurosurgery. So now we are going to face the NEET Super Specialty examination for 2022. So now what happens? You are going to have equal priorities for all the subjects. So you are going to read up all the basics of almost all the subjects. So if you take up a neurosurgery will be covered in Bailey, Sebastian, Greenberg and Yeomans and multiple other books. Now you will not be able to spare each subject every specific time, like all the books have to be covered, which is simply impossible. Even if you do that, you will not be able to make it up for a complete session, and you will not be able to grasp the points which are very important for the entrance examinations. So suppose if you take up the last exam of 2021, which has been conducted recently in January 10, 2022, there is a very unexpected pattern in neurosurgery. Many had not expected this long clay scenarios and also did not expect the neuroradiology questions, and they did not expect the neuropediatric or neuropediatric surgery concern questions. Yes, this is how papers will questionnaire are getting settled. So now if you are going to take up the neurosurgery proper, you will not be able to cover all the books. So now what we are going to deal with is, when the neurosurgery is going to be covered, we are going to divide it into parts. So what are all the topics which are going to be high yield, that is, which will be covered uniformly in almost every paper are: 1. Neurotrauma and basics of neurosurgery, that is intracranial pressure, the Monte-Carlo doctrine concepts and also the intracranial pressure monitoring. These are the two things which are going to be covered uniformly in any question paper. The other high yielding point is, the third high yielding topic is the brain tumors. Brain tumors is a very vast topic which can include starting from gliomas to ependymomas, everything. What exactly you need to know is that brain tumors are going to be your catchy questions. Those who are able to crack up these brain tumor questions will be able to have in higher ranks appropriately. So these are the three topics which are going to be your core topics to be covered. So the maximum contribution is going to be from these three topics. Other small topics also has to be covered, like neuropediatrics part and also the vascular surgery parts, deep brain stimulation, that is the motor disorders involvement part. Few topics has to be raised, like including neuroradiology, peripheral nerves and all. So in that catchy highlighted points only have to be known. So what is the advantage of by taking up all these coachings is, when you are unable to focus only on a dedicated thing, you are in the situation that you are not be able to focus on a dedicated subject. So when we are unable to focus on dedicated subject, when we have to cover a vast number of syllabus and we don't know where precisely we have to stop and where precisely we have to learn, that is where the coaching centers and also the coaching guides come into exactly. In these positions, what exactly we do is, we take up the crux of the topics and give up to the knowledge of what exactly you need, and then we have to work out on the deficient topics of your knowledge, and then we have to upgrade. So there are few standard concepts in which you have to be thorough with, like basics and also neurotrauma, and there are few high yield topics which have to be covered with, like in brain tumors, and few other special parts like neuroradiology, neuropediatrics, vascular and also peripheral nerve. So this is how we are going to cover. Few topics from Bailey will be sufficient and few from Sebastian, but these are not sufficient alone for brain tumors. The brain tumors part will be taken from an exhaustive book and then it will be given to you. I hope I made it clear. Thank you.
Hello friends, welcome to Concept classes. Myself Dr. Mukul Mundra. This I will be dealing with the GI surgery topics for the Concept classes. So in brief, I would like to discuss what we are going to cover. So first and foremost, our priority is to cover the most important which has been asked repeatedly, those topics, and we'll try to find the answers from the Bailey and Sebastian. We'll cover those topics from Bailey and Sebastian first, and we'll move around those topics from the Bailey and Sebastian only, and we'll try to cover from some extra points from the Bailey and Sebastian first. The main priority is to cover those two books. Then some questions have been asked in the past from the swords also. So we'll cover some points from the swords also. Apart from these three books, the next priority will be some higher specialty books. So from which topics we'll be covering from the higher specialty books, like hepatic tumors are really important, like stomach is very important. Stomach repeatedly they will be asking around 20 to 30% of the question will be from the stomach. So we'll cover the stomach part from the high specialty books from some important points also. So the high specialty books like Shackelford, Blumgart and Main Goat will try to cover some important topics, some few points from those books. So the first and foremost, but it will be from the Bailey and Sebastian. We'll cover the previous year questions, we'll cover the basic concepts, and we'll try to cover all the questions which may be asked in the future also, which has not been asked. We'll cover those points also. And previous year MCQs, we'll try to cover all those topics in the classes, so you won't be able to face any problem in solving the previous year MCQs. And then we'll try to cover the MCQs which may be asked indirectly from those previous topics also. So we'll clearing the concept of those topics, so you will be able to solve those MCQs also. And we'll try to cover the recent advances little bit, which has not been mentioned in any of the books also. So we'll try to cover some recent advances question which may be asked.
I am Dr. Pratap Kumar, Consultant Vascular Surgeon, Assistant Professor at Madras Medical College. So we will be discussing about the core vascular surgery topics in this concept classes. Actually, we have some 10 high yield topics. Usually in the venous side you have varicose veins, deep vein thrombosis, pulmonary embolism and vascular malformations. In the arterial side you have peripheral arterial disease, then you have vasculitis, and then you have aneurysms including peripheral aneurysms, and you have vascular compression syndromes like the TOS, and some miscellaneous topics like drugs in vascular surgery. So these are all high yield topics. So we will be discussing each topic one by one. I have prepared separate notes from Bailey, Sebastian and the super specialty book, that is the Rutherford, which is the book for vascular surgery. So we will be discussing those important aspects, MCQ points, concepts in the subsequent classes, and we will be having doubt clearing sessions there also. So this will be the vascular program for the upcoming classes in Concept. Thank you very much.
Hi guys, for the past couple of years I'm sure not only us, the entire world is having a tough time because of the COVID. Even in this tough time, I'm sure you guys are working hard, doing well, and you are also preparing well for the forthcoming NEET Super Specialty exam. I myself, Dr. Hariran, Faculty of Orthopedics from Koncpt Coaching Center, is here to facilitate the easy way of learning orthopedics for the preparation of the super specialty exam. From the orthopedics point of view, there are a lot of small areas, but the high yield areas like infection, tumors and trauma will be dealt in detail. The high yield topics will be covered from books like Bailey and Love, Sebastian, and from the field of orthopedics, books like Campbell will also be dealt in this. Not only the high yield topics, we are also going to cover a lot of image based questions and clinical scenarios in the forthcoming sessions. I hope we will have a good time, and you will learn the basics and also the important concepts of orthopedics, so that though you get few questions from the orthopedics, and you will be able to approach them with full confidence after listening to my lecture. Guys, have a great day. All the best for your forthcoming exams. Thank you.
Dear Koncpt NEET Super Specialty PG aspirants, I am Dr. Saran cardiothoracic surgeon. Cardiothoracic surgery is a unique field. It is the evolving field and it is the future. Cardiothoracic surgery involves adult cardiac like coronaries, multivalvular, aortic. Coming to the congenital, acyanotic and cyanotic heart diseases. In thoracic, we will be discussing about lungs, mediastinum, diaphragm and chest wall. So cardiothoracic surgery needs to have a clear understanding before cracking the examination. So we have made the concepts clear and we have prepared questions from your Bailey and Love and Saviston, and for high yielding points we have taken questions from our cardiothoracic books like Saviston and Spencer and Shields. So definitely it will be helpful to crack your examination and score good marks. All the best guys. Welcome to the academic feast.
Today we'll discuss about implication of revised NEET SS pattern. Hi, this is Dr. Beth, your faculty here at Koncpt. We all know that there is a change in NEET SS 2022 pattern. According to the revised pattern, the total number of questions shall be 150, and this number is increased from previous old pattern, which used to be 100 only. The main challenge introduced in this revised pattern is that all the 150 questions would be from the curriculum of PG exit level. The question paper will consist of questions from general and all sub-specialties of the general surgery subject. So we need to be well versed with all the chapters of our textbook, especially Bailey, Saviston, and some high yield points from a standard surgical super specialty book like Devita wherever required. I'll be covering very important chapters like head and neck, breast, and endocrine surgery from all these books in a clear and concise manner. We at Koncpt are here to help you, and I believe with our guidance you can definitely excel in your exam.
Hello guys, how are you? Dr. Adity here, MBBS MA General Surgery. So I am taking care of the trauma topic of yours from I am a Koncpt faculty, and you go through the concept material regarding trauma. It is very nice and wonderful. You will be happy after reading it, and all the contents taken from Bailey, Saviston, and also ATLS recent guidelines. Along with that, we have covered up specific books for specific trauma like renal trauma. We already covered from Campbell also. Be thorough, revise. This is the main key to get cracked in the NEET exam. And to be honest, I also cracked my NEET from the concept materials only. So it is a very old institute, and we are analyzing the questions from past 5 years, 10 years, and accordingly we are putting so that you will face similar question or same questions in the exam also, so that you will be confident after exam that you did something well. So don't worry, read concept materials and all the topics compiled over there from all the books, that is standard textbooks from which the questions are framed. Okay, so don't worry, be happy, and all the best for your exam.
Hi friends and dear NEET 2022 Super Specialty aspirants, I am Dr. Manika. I am a consultant plastic surgeon and I passed out from Grand Medical College, Mumbai. So I am here to take classes and discuss the topics in my field of expertise, that is plastic surgery. So these classes will be as per the current new format of the NEET Super Specialty entrance. So I will be covering all the relevant syllabus from recent editions of Bailey and Saviston. Other than that, I will be focusing on few selected high-yield topics like cleft lip and palate, craniofacial anomalies, hand fractures and congenital hand anomalies, skin and vascular tumors, and brachial plexus and other nerve injuries. These topics which are very high yield in your MCQs, So I'll be taking few conceptual topics and also your MCQ oriented points from dedicated high-end plastic surgery textbooks like Nelligan, Mathis, Greens and Indian textbook of plastic surgery. So the classes will be made in such a way the basic concepts are very clear for you, and also you are not missing out any important MCQ points from these topics and the relevant syllabus of plastic surgery. So all the best and let's do some good work.
Good evening. This is Koncpt NEET SS exit exam online coaching. For pediatric surgery NEET SS exit exam, the books that will be followed are mainly Sebastian, Bailey and Arnold Coran textbook of pediatric surgery. The main topics from Sebastian Bailey and the high-yield topics from Arnold Coran textbook will be discussed. Mainly we will be dividing the topics into thoracic, abdominal, pediurology, pediatric trauma and pediatric tumors. So these books should be followed, and these books should mainly cover all the topics even pertaining to the changed pattern that has come for the NEET SS exit exam. Thank you.
I think all this content by our faculties have cleared some of your doubts, so that you can start preparing and you can utilize our classes in a nice way. February 25th this class starts online live lectures, so the material also will be given so parallelly. And one thing which I request the student is, see, here we plan the classes evening 6 to 10 p.m. Daily, so 5 days a week, and maximum whatever the content, possible content which we can give, irrespective of the time, we want to give the content. So we expect like almost 90 to 100 hours, maybe the possible duration of the lectures, so that the students, from the students' point of view, they can utilize the lectures very well. And more important here is understand the concepts, understand the images from the textbooks, and whatever content given by the faculties, please make use of it, and more MCQs please work. We are also working with the new pattern of multiple choice questions, since the pattern has changed, and we are also working with respect to that. Please make use of it, and the Koncpt team will always be there for you to guide and help. With any difficulties or any doubts, you can message or WhatsApp me, so that we will be working for that to enlighten the knowledge and help you people in a better way. This is Dr. Anthony Kumar, founder, president, Koncpt. Jai Hind.